diathermy set up using the Curipulse 419 machine with the electrodes in a contraplanar setting. This setting can be used for acute lesions or chronic lesions that are slightly deeper, where you want to achieve the effect within these deep structures. Prior to setting up these electrodes, you would check that your patient had no contraindications to treatment. You would check that you had consent to treatment from your patient. You would inform the patient that they should be expecting from the treatment, and you will have tested their skin sensation using the test tubes. So in this contraplanar setting, if you wanted to do pulsed shortwave therapy for an acute condition, you could set the pulse repetition rate at perhaps 35 and the peak pulse power at 20%, giving you a maximum peak power of much less than 5, and therefore you're achieving the non-thermal effects of the treatment. If this was a chronic condition, perhaps something like osteoarthritis of the knee joint, and you wanted the thermal effects as well, then you would set the machine on a continuous setting and setting the peak power to anything between 5 to 11 watts, informing the patient that they should feel a gentle warmth during the treatment, but not significant heating or any discomfort as a result of that. Treatment times can vary. Treatment for an acute lesion would probably be nearer 10 minutes, whereas a treatment for a chronic lesion could be anything up to 20 minutes. Once the treatment's finished, make sure that you turn the machine off and move away. And while the treatment's on, make sure that you're at least 1 meter away from the machine as a therapist to protect yourself.